Hi everybody. This video answers a couple of questions from caregivers. How can caregivers discuss a parent's dementia with a primary care doctor? And even more importantly, is a primary care doctor the right doctor to effectively treat dementia or Alzheimer's or memory loss or related conditions? So to address these questions, I'm first going to talk about patient-doctor confidentiality, and then I will outline a process of diagnosing dementia and available treatment and physicians or specialists that you might want to consider. So first of all, if you're a patient, know that all of your medical information should stay confidential unless you complete a written form at your doctor's office about who the office staff can share your information with. You can do this by completing a HIPAA form. That stands for Health Insurance Portability and Accountability Act. It allows doctors to share your information with other doctors' offices and other people. Sometimes doctors' offices will have another permission form saying that you can designate your spouse or your parent or somebody else in your family, your children, to receive information. And then another way to do this is if you have completed your estate planning documents and you have an agent under durable power of attorney form for medical and you've appointed somebody, you can give that form to the doctor's office. So the complicating factor that most caregivers don't realize is unless your parent has given written permission for their doctor or anybody in the doctor's office to speak with you, they can't. They cannot do that. Confidentiality can become an issue for caregivers if you're taking mom or dad to the doctor and you'd like to have more information but you're not getting it, so you're frustrated. Let's say that you drive mom or dad to a doctor appointment. They may even let you come into the doctor's room with them, but the doctor is not looking at you, the doctor's looking at your parent, they're not talking at you, they're talking to your parent, and they're even asking your parent, hey, is it okay if this person's in the room? So for a caregiver to talk to a general practitioner or primary care physician about a parent's dementia, again, you need written permission. Now, this can be a little frustrating, especially if you have a parent who you suspect has memory loss, and you're expressing concern saying, hey, mom or dad, I think you're a little forgetful. Can we go talk to your doctor? And they're like, I don't want you involved at all in my medical care. I'm not signing any forms. Now, let's kind of go beyond that in some cases. If you've taken mom or dad to the doctor's office and there really is no written permission and they don't want to give it, you might be able to talk to somebody in the doctor's office and express some concerns, or mail a letter to the doctor's office and express some concerns. Now, this does not mean that the doctor has to do anything with the information that you provided because their obligation is to the patient, which is your mom or dad. Now, if you live in a small town, in a rural area, some doctor's offices may be a little less strict, but you have to know they're still bound by patient-doctor privilege, and they're still bound by federal and state guidelines for confidentiality. So unless your parents give you that permission, you can't talk to them and the doctors can't talk to you. But let's say that you do have written permission, or you are that agent under durable medical power of attorney, and you put the form on file with the doctor's office. In this case, you can talk to the staff. You can schedule appointments. You can attend appointments with mom and dad. So this kind of leads to the answer for the second part of the question is, can a primary care doctor treat a parent with dementia? So in most cases, unless mom or dad sees multiple doctors and they already have a neurologist, a primary care doctor is probably the first person to diagnose your parent with memory loss, but it depends on the medical practice. So is your parent's primary care doctor or general practitioner a 1 or 2 doctor office? Are they a small doctor's office? Or are they part of an office that is part of a larger health system or hospital system? Two different situations. And do your parents, doctor, do they treat people of all ages, babies, 90-year-olds, 50-year-olds? Or is their practice mostly older people? And the reason I ask this is because treating dementia, in my opinion, really is a specialty. It requires doctors who have additional training and additional skills. And the way that memory loss usually is first diagnosed is through a simple paper test, 20 questions. Now these are called certain names, but normally they're acronyms or abbreviations. So like MOCA, M-O-C-A. Another test is SLUMS, S-L-U-M-S, or M-M-S-E. And the concern is you want to know that there is significant variability in the training and the skills of the individuals who give these tests. Sometimes it is a doctor. Sometimes it might be a social worker or a nurse practitioner or somebody else. And so really anybody can get a copy of these paper tests, right? Anybody off the street could get the test to determine the possibility of early memory loss. But if you're doing the test right and you understand how the test should be done, there are time limits to be maintained for these questions. There are ways that some of the questions should be asked or presented, as well as some variability in how the tests are scored. I will tell you, most people given the test don't even know about this, right? So for you, there is no harm in asking a person what training they received to give these tests, and do they give the tests regularly? Because in a perfect world, the person who gives your parent the test would be the same person who gives your parent the test in 6 months and a year and a half and 2 years from now, so that the results are consistent. If you have different people giving the tests, you don't know what their training is to give the test. You may get all kinds of different answers and scores that are up and down and all over the place and unreliable. I can tell you that I've worked in this industry for over 25 years, and I have seen almost everything from office staff who attempted to help my clients pass the test by giving them hints, or they extended the time to complete the tests, or they asked the same question multiple times, or they gave my clients multiple do-overs to see if they could possibly get the right answer to the question. These individuals should not have been permitted to even give those tests, because inaccurate testing can have serious long-term consequences for patients. Honestly, I've seen the same thing at the Department of Motor Vehicles, where testers clearly didn't understand that my client had dementia and they shouldn't be driving, and they clearly should not be helped to pass a test that would permit them to drive and put other people's lives in danger. So, some primary care doctor offices are more skilled than others in testing for early memory loss. Add to this that primary care doctors without significant experience in treating dementia patients may not be skilled in doing these tests or even in prescribing medications appropriately. And depending on where you live, obviously big cities, big metropolitan areas have more doctors, more specialists. It's easier to get care. If you live in a rural area or a small town, it may be a nurse practitioner or a physician assistant instead of the doctor seeing patients and administering these tests. This is just, for better or worse, it's a reality of the healthcare system and a shortage in the availability of treating physicians. So be careful about seeing practitioners who don't have experience in memory loss. It can be a significant disadvantage for your elderly parent or yourself if you have Alzheimer's or dementia. It's okay to ask questions about their qualifications. It's okay to say, hey, can you refer me to somebody else who's got more experience? No worries, I want to go to the right person. So in a perfect world, if you are the caregiver or the person with memory loss, my recommendation is to see a geriatrician, which is a person who specializes in older adult care, a lot like a pediatrician who knows a lot about babies and young children. It's just on the other end of the spectrum, young and old. See a neurologist and a neuropsychologist. And in some cases, when dementia or Alzheimer's is accompanied by behaviors, you may also need to see a geriatric psychiatrist or consult a geriatric pharmacist. Because medications that are given to the elderly, a lot of them have side effects and risks, but a lot of them are also very good and very helpful. But I have seen so many elderly persons overprescribed medication, too many medications that counteracted, all because physicians didn't really realize and have the experience to know what they were prescribing. So again, depending on where you live, there may be shortages of these physician specialties. Even if you live in a metropolitan area where there's a lot of specialists, there can be weeks-long or months-long waiting lists. So my advice is don't wait. Schedule ahead. It's usually worth the wait. Having the right physician diagnose memory loss and work with you to develop a plan for treatment can make such a big difference. If your parent has vascular dementia instead of Alzheimer's disease, or one of the less common types of dementia like aphasia or Lewy body dementia, or dementia related to Parkinson's or MS or some other neurological disorder. I have seen so many individuals misdiagnosed and then treated for this misdiagnosed type of dementia for years because nobody in the family thought to ask a question. Nobody caught an error in a medical record, or family members were afraid to ask doctors questions. And in many of these cases, this also means that these individuals who are misdiagnosed were misprescribed medications for conditions that they didn't have, or a treatment plan was created for something that they didn't have. It was a wrong diagnosis. In my opinion, it's easy for medical practitioners to just group everybody with memory loss, just like group them here and say, oh, we're going to treat them all the same. They all deserve the same treatment. They don't. Diagnoses are different. Everybody's different. So to answer the questions, in summary, if you want to talk to your doctor about a parent's memory loss, you need written permission. And yes, a primary care doctor can diagnose early memory loss, but if you want a better diagnosis, a more thorough treatment plan, more accurate medications, find a way to see a geriatrician, a neurologist, a neuropsychologist, a geriatric pharmacist, and in some cases, a geriatric psychiatrist. I'm Pamela D Wilson. I'm a caregiving expert, advocate, and speaker. I thank you so much for being here. More information about this topic is on my website, PamelaDWilson.com. The links are below this video. Please do like, share this video with others, follow my channel, comment, ask for a video topic, share your story, say, hey, thanks for the video. One little thank you goes a long way in helping other people find their way here who are looking to solve similar problems and who have similar questions. I'll see you all again soon in another video.